I'm Dick Sibley, I'm a veterinary surgeon from Devon, and I'm here in West Wales to talk about Johne's disease. And Johne's is a debilitating disease, chronic debilitating disease of cattle, generally affecting animals of 3 to 7 years old. And in classic terms it causes scour, weight loss, poor production, and eventually death. It's an incurable condition. It's controllable. And the problem is that we don't understand quite how, but infection generally occurs in the first few weeks, few days of life as baby calves, and then the disease goes into remission for anything to 3, 5, 7 years. And we can't spot these animals. So what we're doing on this farm is testing all the cows through the milk by looking for antibodies in the milk. Every cow in this herd is tested 4 times a year for the presence of Johne's disease, and we can identify the infected animals from the results of those tests.
My name is Peter Alpin. I'm a veterinary surgeon. I've been working in practice for nearly 30 years. Over the last 10 years we've worked very closely to actually help control Johne's disease in the UK in a large number of herds. And what we've actually found is it's a disease that is spreading quite quickly as herds expand. And if we want to actually control the disease, the most important thing we need to do is to protect the baby calf. Here, these are the replacement calves for this farm, and it's essential that they don't become infected with the disease so that they can then have a long, productive life. Infection with Johne's disease typically occurs in dairy farms in the first 24 hours of life. And really what we're trying to do is to make sure that these baby calves, when they're born, don't have any contact with any infected cows. There are 3 routes of infection. The most important route of infection is from the infected cow, which actually is shedding large numbers of bacteria in her feces, and that contaminates the pen, and it may contaminate the udder of either the mother or indirectly the udders of any other cows in the pen at the same time. The calf then suckles and actually takes in the infection at that point. The other route of infection is through infected milk. So if we take milk from an infectious cow which has been infected for some time, and we actually feed it to calves, replacement calves, that is another efficient route of transfer. And finally, in a very small proportion of calves, we can get infection through the bloodstream, but this is not a very efficient route and only occurs in about 10 or 20% of cases. So if we can actually prevent the calf from becoming infected, then we'll actually end up with a healthy group of cows, and then as a consequence the chance of infection spreading to the calves becomes less. So it's all about actually trying to break the link between infection from cow to calf.